Hello, dear Acrist. You selected this video because you want to see what is going wrong with this Pangio Kuhli, a Kuhli loach that is infected with a bacterial and a worm infection. I may be wrong. You can discuss this with my findings. You can put some comments about how I discuss fish diseases and how I try to teach you to use a microscope and to understand your findings and understand that you can apply appropriate treatment depending on your findings. So I will share you my PowerPoint where I will show you what I found in this Pangio Kuhli with a bacterial and a wound infection, case 267. You can find more about fish diseases, about prevention, about diagnosis, about the use of medications, all available in my books, and they are available in different languages. See the link below in the description. And we had a Pangioculi seminctus presented to us that became very skinny and they died. We checked the skin and we found a lot of bacteria here covering the black parts here are big amounts, colonies of bacteria that are affecting the fish on the skin. In the gills, we found the gill lamellae, which are gone on these gill arches here. So that means there is a very poor gas exchange and the fish have a kind of gillmonia, like pneumonia by mankind. Well, they will die from this infection in the gills. And internally, we found a nematode worm here next to the intestine, the gut. We see some bleeding parts here in the gut, which is not normal. It should be clear. And we found that some of the organs were not in good condition. Here we see parts of the liver, and then we see here the spleen, which is enlarged and has big open vacuoles. Well, this is not a good sign with the gut, with the worm, and also with the organs that seems to be in bad shape. And then we checked also the abdominal fluid of this coolie loach, and you can see the amount of bacteria, all those black spots, also those black specks, which are colonies of bacteria. Here are millions of bacteria that are affecting the fish and, of course, eventually killing the fish. So bacteria play a very important role for this coolie. So what can we do or suggest for treatment? Well, you will need to treat the bacterial infection and also the worm infection. Usually the bacterial infection is secondary, but you have to treat. The worm infection weakens the fish, so it's more vulnerable or more susceptible to get bacterial infections. So do a combination of antibiotics with an anti-worm like praziquantel. That is possible. You can ask your fish doctor or your vet for advice. And at the same time, you can help with a functional fish food like our Dr. Bassleer Fish Food Garlic that helps the fish to protect himself and to repair himself much faster during infections. My books help you to understand fish diseases, how to diagnose and how to treat. And to become a more advanced expert, you want to learn more about diagnosing or how to diagnose a fish disease, or you want to learn how to quarantine fish when they arrive, go to my Patreon and be part of my study. So I thank you for watching and understanding this disease which I encountered on this Kuhli Lodge. Take care. Bye bye.